I want to follow up on Dr. Gales's initial comments in his report out and just talk about how deeply troubling and shocking the last 4 days have been in our country, thanks to this president. Local jurisdictions have had to overcome the incompetence and lack of leadership to establish testing, to establish our own roadmap to secure PPE, and effectively be on our own. Thanks to the efforts of Dr. Gales, Dr. Stoddard, and an army of public health officials and frontline medical personnel and emergency responders and service workers, Montgomery County has been able to overcome a lot. And our numbers today are thanks to those heroic efforts, including the efforts of our residents and citizens who have not listened to the White House, who have listened to the silence, to have listened to Dr. Gales and the army of public health officials, including Dr. Fauci, who have provided the correct information for us to follow. But what we have seen over the last 4 days goes into a new phase. The diminishment of this virus is just such a naked and raw attempt to try and retain power, to minimize this, to potentially impact an election. And the rhetoric, especially last night, and those images of the president walking into the White House, I got no sleep last night because it is just absolutely terrifying that the messaging coming from the person who's supposed to be our leader is so wrong and so incorrect. And now local jurisdictions, once again, are going to have to spend time and energy and resources to overcome that messaging. I remind all of our residents that it's not just the mortality rate of this virus that is terrible and shocking, but because of how quickly it spreads, what we experienced in April and May, when such a large percentage of our population overwhelmed our health providers and emergency rooms, it has a cascading effect on public health, not just specifically related to the COVID, but any other issues that may arise in public health in communities. And so we absolutely have to continue to be vigilant and adhere to the guidelines that Dr. Gales has been advocating for and making sure that we follow from the very beginning. We cannot stop. And now we have to work even harder to address the misinformation that we are receiving at the highest levels of government. I read a story in Politico last week that in September, there was a concerted effort to conceal information on the impact on children and youth of the virus by this administration. There is no bottom. There is no bottom. They are willing to put everyone at risk, everyone, including our children, in order to push forward an absurd message that is dangerous and that will negatively impact all of us. So we must remain vigilant through all of this, and I'm confident that we will overcome this messaging. But I did have one question as we wrap up. The White House is not participating in contact tracing right now. And if they were a business in Montgomery County, if the White House were a business in Montgomery County, they would be admonished. And I remind everyone that many of these employees live in Montgomery County. And I'll just say this also, what the president is doing is a slap in the face of all of the frontline medical personnel, including the people at Walter Reed that treated him, again, many of which reside here in Montgomery County. And so I'm going to try to calm down a little bit, but Dr. Gales, if you could talk a little bit about the importance of contact tracing and what it should look like when a business such as the White House has the kind of outbreak that we are seeing right now, and what should be done if something occurs within a school or a business here in Montgomery County.
Sure. Thank you for your comments. And I echo the sentiment. I think the most important tenet of contact tracing is transparency. And so any business or entity who has cases owes it to their staff to be transparent about the potential exposure and risk of exposure that they carry, because it's important for them to be able to seek the necessary health follow-up that they need in order to be safe. The contact tracing process, so for any individual who is a resident of Montgomery County, if we are notified that they test positive, we would conduct a contact tracing exercise and investigation within which we would engage potentially their employer, dependent upon their level of exposure and others who may be exposed. And we would provide the necessary guidance in terms of them being isolated, as well as identifying any other potential contacts who are at risk of exposure by definition, and would encourage them to get tested, but also require them to quarantine. I want to emphasize one point here as well. If you have been given isolation directions or quarantine directions, having a negative test does not exempt you from completing that time period. So if you have tested positive and you have been asked to isolate for 14 days, if you are feeling better, that does not mean you go back to work. If you have been told to quarantine and you get a negative test, that does not mean you are exempt from completing that quarantine process, because as we know, that quarantine process is put into place for a period of time because you could test positive anywhere during that window. And so we just want to make sure that folks at home, again, understand that even though you may be seeing this play out differently on TV, these are the real expectations for those of us on the ground if you were to test positive or be identified as a high-risk contact, and the expectations that would come with that.